Good evening, everybody out there in social media land. Welcome again to another installment of Medical Talk in Layman's Terms with Nurse Charlene. And tonight's topic on my Back to the Basics series is Your Body's a Snitch, Believe It, Part 2. Meaning I already had Part 1. Where was y'all at? I'm just playing. But yes, it's part 2 tonight. And as you can see, I didn't disappoint with my beautiful drawings in the back. And I'm going to see what I got back there and stuff. But I got a little bit of everything. I got help. And it says that one's the doctor, the person telling on whatever they have happening and everything. This one right here and stuff, we got a little bit of dizziness. So what I'm calling these are symptoms, so dizziness and different things like that. And then the one at the top has some other things going on and stuff. It's a little bit of everything, but I'll be able to explain my board shortly into as we go in. Also on this side, some things that help us say help, stuff, possibly drinking too much, possibly, too much marijuana, not just enough to get you okay and stuff, but a little bit too much marijuana. Then we got a hypodermic needle for, I guess, maybe crystal meth. I don't know what you do with it. But anyway, for some dope and stuff, prescription drugs, cigarettes, yeah, and vaping. So cigarettes and vaping and cigarettes, they mean the same thing. Like snitch is symptoms, symptoms is a snitch, and everything and stuff. A band-aid, yeah, if you stop doing whatever you're doing to get the band-aid, you might not need it. And then I got you a little stethoscope to let you know that this is medical talk in layman's terms and everything. So my thing is, when I come on each and every time and I pick a topic for you guys, I really think it out. I just come on here to, just be seen or something like that and stuff. I come on here because I want to help you, because people ask me, regardless to whether I got a podcast or not, they've always asked me, I got this rash on here, or I got this sore right here, or I got this cut right here. What happens if I'm always dizzy? Why is my blood sugar 500? What's happening, and stuff like that. And most of the time, I can tell them something, but I'll tell you what I do all the time. And that's go to your doctor. Find out by going to your doctor, and everything and stuff, because it's something happening, and it's very important that we start seeing that the doctors the doctors are our friend, and stuff. First of all, the doctors are there to help, and stuff. And that's why God gives them the wherewithal to be able to learn, first of all, and then be able to, actually save a couple lives along the way and stuff. So the reason for me coming on here is because I wanted to kind of bridge that gap between people want to help, but then they don't understand the doctor. This is my thing, and this is no down put to the person, which is the patient, or the doctor and stuff, is to actually just have the nerve to really vet your doctor out. Check them out. If they're mean, you don't feel like you can comfortably come to them and tell them, hey doc, I'm itching down there, or this is hurting, or my underarm, or whatever it might be and stuff. That might be the wrong doctor for you. There's other doctors. Don't torture yourself, and stuff like if the doctor ain't getting it, then they don't need you. Let them have their other patients and stuff. They just don't need you. Go to another doctor. You're not, just like, it's not written in stone that you go to that particular doctor. That you might need to find you a doctor with my sister said it right. It was ethnically stable or something like that, where they care for you. You feel like they care for you no matter what your ethnicity is and everything and stuff. You know, like some people, you might see them smile at another ethnicity, and then when they see you, it's you. You know, and stuff like that. That's the wrong doctor. I'm gonna tell you that now. Either you punch him or run for the border, you know, or something like that and stuff. That's the wrong doctor. So while I'm saying that and stuff, it's very important that we start making sure that the doctor is for us and what the heck is going on with us, or you're gonna lose. Not the doctor. The doctor ain't gonna lose. They're gonna keep on practicing medicine or whatever they do and stuff like that. But you're gonna lose and everything. Welcome on in, you guys. Miss Sandra, she said, good evening, Nurse Charlene and Rosie. Sandra and T are here. Good evening, Sandra and T. Thank you for coming on. And then also, thank you for coming on, Miss Michelle. Happy holidays to you and your family, your beautiful family. Yes. All right, y'all come on in and stuff. And if you have questions along the way, just understand that I'm on here and I'm just getting to the little quick basics. Excuse me. And that is that I'm on here trying to bridge that gap, you know, and if I can't bridge it and stuff, then we need to build another bridge over here. You know, that means getting you another doctor that's going to actually care. That's it. Welcome on in, Miss Sonia. That's my sister. She said, culturally sensitive to your needs. That's the word that I was trying to, I said ethnically sensitive or something like that. But anyway, yeah, culturally sensitive, meaning that they have a flair. It doesn't matter who the doctor is, but if they're culturally sensitive, it doesn't matter who the doctor is. They can be any color, but if they know how to really just relate to you, no matter what, and they see you as somebody they need to help, and not because of their own preconceived motion or stereotypic motion of she coming in here and she got a you know, or something like that, and so they don't want to help you and stuff. Well, might mean, boy, I got about 15 different things going on, or girl, I got about 17 different things. Can you help me with all of them? You know, and stuff like that. So you want to make sure that you get in that rapport and stuff. And let me tell you how strong that rapport needs to be. And this is a shout out to nurse practitioner Rebecca Reisman of Emeryville Family Practice. And Rebecca and I have been together. We grew up together because she's been my nurse practitioner doctor. That's my doctor. And she's been my doctor for 20 consecutive years. Who does that? Exactly. And stuff. Because if you found a doctor and you've been there that long with them and stuff, go ahead and stick with that one. They're going to eventually figure it out and stuff. But if you haven't had a doctor that long and everything, it's okay to trade doctors. If they're not doing what they're supposed to, they're not meeting your needs, you feel like you are bothered to them because they don't want, you got too many things wrong with you and you trying to tell on them. Charlene said your body's a snitch. Come on now and everything. So Sonia said, okay, the meaning that they can, a culturally sensitive practitioner, period, it means that they can identify with your needs and your struggles that you identify with and everything. So that does make sense and stuff. Yes. Thank you for that and stuff. And so we learn a little bit every day, you know, and stuff. But I like that culturally sensitive, meaning that they can identify with your struggles. They become more like a family, a piece of your family, instead of that's just my doctor. I ain't telling her nothing. I ain't telling him nothing and stuff. He always act like I'm the problem, you know, or yeah, y'all not supposed to be in court. You know, y'all supposed to be in healthcare, you know, doing a health thing and everything. And it's a shame that I would sit up there and badger you about getting your health taken care of, and then you going up to battle with your doctor because you telling on it. Either your doctor doesn't want to work because they tired and they overwork, they under, taking care of their self, and everything and stuff, or you need a new doctor and get a new doctor. Stop trying to do it because so-and-so had it and my cousin had this doctor and they've been good to them and stuff. They might not be good to you. They might not be culturally sensitive or something, and everything. So thank you for that, Sonia. And stuff. So going back to what I was saying, let me go ahead and read my podcast disclaimer. I ain't never went this long and then not read it, but it's okay because that stuff, it needed to be heard. The podcast is for informational and educational purposes only. It is not intended to replace professional medical advice, diagnosis, or treatment. Always consult with your physician for any medical concerns. If you have questions about a medical condition, reach out to a qualified healthcare professional. Never disregard professional medical advice or delay seeking it because of something you heard on a podcast. Guest views are their own and may not reflect the views of the host or this podcast. The information shared is for general knowledge. It should not be used for any legal or medical purposes. Always consult with a licensed professional who knows your medical history for a meaningful evaluation. And you guys stay informed, but always seek professional medical advice when it comes to your health. Go to your doctor. And if you're having problems with your doctor, get another one. Period. That's the end of my rant. Welcome on in, Antoinette. That's my cousin. She said, hey, everyone, it's Tony. I'm here. Thank you for coming in. I'm teaching on your body is a snitch, believe it. But now I'm breaking it down on why that means something and stuff. So I'm going to go ahead and dive into a little bit of explanation so that you know why I'm doing this in the first place. Oh yeah. Let me see this. This is a good one. Sonia said, stop getting resident doctors. Request an attending doctor because the attending doctor is there permanent. Resident doctors are in rotation every 3. Oh my God. Okay. Thank you for telling me that resident doctors are in rotation every 3 to 5 years, meaning I've had this situation happen, and Sonia knows a lot about this because we share the same mommy and stuff. So the big thing about that and stuff is this is the important part about that when she said a resident over getting an attending doctor. That means that doctor is a pillar in that health care clinic or whatever and stuff. That doctor is there to stay. That doctor is going to get old with you and everything. You get a resident. That's why your doctors rotate out and stuff. And I watched my mother. She was so mad one day and stuff. She was like, I've been at this doctor's office for I guess it was about 5 years at the time and stuff. I've been at this doctor's office for 5 years and I had 9 different doctors because they're leaving every 1 or 2 years and stuff. They're not even, I'm like, is the doctor's office not paying these people or something like that? No, they're residents. So they just get their practice in and then they're out. And you're stuck with your same problems and your same struggles, and the doctor is out. They gone on to the next life, something easy and stuff or whatever, or harder, I don't know, and everything. But it's really messed up and everything. And then Sonia also said that the nurse practitioners are great. They are, because they have something to show, and stuff. They have a doctor over them, but they're actually doctors, and everything. They took that advanced medical practice and everything and stuff, and they got their self up, because the nurse practitioner, I'm a registered nurse, but a nurse practitioner is me with a little bit more medical, going further in my medical background and everything to become a nurse practitioner. And that means that you're basically a doctor, but a doctor oversees you. A doctor should always oversee other doctors, you know, and stuff. So it's nothing different or nothing bad about that and stuff. That's actually wonderful. And that's why I told you that my nurse practitioner, Rebecca Reisman, it has been my doctor, my personal doctor, for 20 consecutive years. This is a big deal. That means I trust her, but she actually trusts me and stuff, you know, and it's not that and she even gets the word of being culturally sensitive, meaning we are not the same ethnicity, but she has respect for me. She has respect for my title as a registered nurse also, and everything, and the wherewithal. So we mesh really good and stuff. That's really hard to find, but it can be done. So I wouldn't give you that advice to go get another doctor or something like that if it couldn't be done. But you shouldn't torture yourself. You only get one life. If you waste your time on this one doctor, but you can't tell him nothing, then you're going to end up going downhill, and you're going to be in a hospital somewhere messed up, and the doctor's on about his business, taking care of other people, you know, and everything. If you don't trust your doctor, yeah, that can't be your doctor. That's all I'm saying. So going on to the topic tonight and stuff is your body's a snitch, believe it, and why that is being said. Okay, one more comment. I got to put this one up there and stuff. Sonia said, you're a registered nurse for now, but you're going back to school like you promised us. Okay. The cat is out the bag. Yes, I'm going back to school. I'm going back to Cali. Yes, I think so. Yes, and Antoinette said, I love my doctor. He listens to me. Absolutely. Yeah, you better not trade your doctor. That's a big deal and stuff. Definitely. And yes, I will be getting on down and stuff and getting my advanced practice. I still got a few. I'm only 21, so I got a few years left on me, you know. Okay, I'm lying. You see, I stuttered and everything and stuff. No, I'm not only 21. I'm 21 plus 21 plus something else. But anyway, as I digress, tonight's topic is your body is a snitch, believe it, part 2. Meaning I already did part 1, but this is how powerful this is. It's not just a catchy phrase, you know, when I say that, you know, your body is a snitch. You know, snitches get stitches. No, and stuff. That's that kind and stuff. But we're doing the legal medical kind and stuff. Your body is a snitch, believe it. And it goes like this: understanding how your body warns you before things get worse, before the check engine light of your body comes on. So that's one of the things and stuff, is understanding how your body warns you before things get worse, or before that check engine light of your body comes on and tells you, Houston, we have a problem, if that makes sense. And then your body snitches on itself every day. Every day. It sends early warning signs, symptoms to tell you something is wrong, out of balance, or needs attention. Okay, so it sends symptoms to tell you something is wrong, out of balance, or needs attention. These signals are often ignored, minimized, or misunderstood, but recognizing them early can prevent serious illnesses and even save your life. Recognizing them early. Okay. And so last week, I just told y'all about my mama. So behind the scenes, you know, I'm on here and I'm getting down and stuff like that. But behind the scenes, we're fighting for my mother's life, you know, and everything. And that's not no joke, you know, to go through 7 cycles of chemo, 2 weeks of, a piece and stuff. And then to have this big, huge surgery, and then all the other aftercare that comes with it and stuff. We're still in a journey. Make no mistake. But they took that tumor out. Make no mistake. But what if she didn't snitch? And what if I didn't take her to the hospital and just gave her some Tylenol? Because, Tylenol heals everything, right? Okay. So that's why I'm saying all of this. And that's why I'm so passionate about it. I'm living it. I'm living it. I don't have time to play no more. Playtime is over. I'm living it for myself. I see it every day, every single thing, all the monitoring I have to do. I have to be a real nurse. I can't play around with a thermometer. I can't play around with some Tylenol or something. I got to get it done. It's important, or somebody won't make it. Okay. Some definitions I want to give you. What is a symptom? A symptom is a snitch. A snitch is a symptom. A symptom is a physical or mental change noticed by a person that indicates something may be wrong. For example, pain or shortness of breath or fever or dizziness. Those are symptoms. Those are snitches. If you're dizzy, it means something. If you have pain somewhere, it means something. Not, I got something for that, and that's it. Yeah, why did it come in the first place? That's what I'm trying to get to, and getting you to realize is, why did it come in the first place? Why is it there? What is it doing? Why does it want to give me a pain here? If you get a toothache, that means something wrong with your tooth. My tooth, your tooth, it doesn't matter. It's a tooth, or whatever it might be. I'm just saying. Okay, signs is an objective finding that can be observed or measured by a healthcare provider. For example, taking your blood pressure with a stethoscope and a sphygmomanometer or whatever and stuff, or what they call this Dynamap that they roll in. They put the blood pressure cuff on you, and then they push a button and and squeeze the heck out of your arm and stuff, and then it spits out a number and everything. So that being measured, that's the sign. That's a sign something is wrong. Yours is 164 over 101. That means you got some type of high blood pressure, or either you just got stressed out before you came in and stuff. But most likely, if they do that and then you're just sitting there and nothing is wrong with you apparently and stuff, and that happens and stuff, that's a problem. They're going to take it again at the end of maybe that doctor's appointment and stuff. If it's still high, you got high blood pressure. Whether you just, if I don't breathe and I just sit there, yeah, it doesn't matter. It doesn't matter. Welcome on in, Kiki. Yes, I missed you. Yes, come on in. Come on in. All right, so that was a sign. And then also there's early warning signs. And that would be a mild or new change to your body uses to alert you before the condition becomes severe. So it's a mild or new change your body uses to alert you before the condition becomes, something serious that you got to deal with. For example, unusual fatigue. That's an unusual amount of tiredness. You just can't even bring yourself to lift your head out of bed. It's not the same as I'm just tired, and so no, we just tired every day. And stuff. This is some extra tired that don't have nothing. You can't even get the words out. I'm just tired because you're so tired. That's how bad it is. It's breaking you down and stuff. So you're going to know that it's a problem and everything. And examples is the unusual fatigue before a heart attack. So that unusual tiredness, and then you end up having a heart attack and stuff. And I didn't even know it was that bad or something like that. And then also anything that increases the likelihood of developing a disease. For example, smoking, age, or genetics. It's in my genes. We all had this. We all had that. We all had this go wrong with us, or something like that and stuff. That's where that comes in at. And that's the risk factor and stuff. So why the body snitches? And then it says causes of common symptoms. So what I'm gonna do tonight and stuff is gonna be a little bit different, just a little bit, and that is I'm gonna give you a symptom, and then I'm gonna say the possible causes of that symptom, and I'm just gonna kind of pour through them and stuff because it's too many to kind of go through each and every one of them perfectly and stuff. But I want you to get the gist of what I'm trying to do, because it's your body is your body is a snitch. Believe it. Snitch meaning your body tells on you, tattletales on you and stuff, and you need to believe it because it's trying to tell you, and it's more of an expert than you are because it can see inside of you. That's your internal conscience, your internal gut, and everything telling you it's a problem. Your kidneys is acting up. Your so-and-so is acting up. You're constipated. Now you got diarrhea. Now you constipated, and all of that good stuff and everything. So this is how I do it. So first I'm going to say fatigue. That's the unusual tiredness. That's above being just tired. Everybody get tired. This is above that. So it's going to stick out more because you might not even be able to express that you're that tired. Your body just going to start doing crazy stuff. You're going to be forgetting. You're going to get dizzy. You're going to be tired and sick to your stomach. It's going to cause some trouble. But possible causes of extreme tiredness or fatigue and everything is heart disease, because it reduces the oxygen in your body. It decreases the oxygen that's needed to give you that energy to keep on going. Your body and tissues need energy. They need nutrients and everything and stuff. And they all got to go together inside your blood and make it to all the parts of your body, your brain and everything else. They need to be fed and everything. So if you got extreme fatigue, it's reducing the oxygen to your heart. Your heart needs oxygen. First, it needs the blood, and then it needs the oxygen and everything, oxygen-rich blood, and then it pumps through and sends it where it needs to go and everything. So that's one. Anemia. Oh, girl, you anemic, and all of that. You anemic, and stuff. Your red blood cells is down, because that's what it means. Your red blood cells is down. But guess what? Your red blood cells are important because if they're low, that means your body is not properly functioning. So therefore, you could be constantly cold. I know somebody that I love very dearly that's always cold, and it's probably due to her being anemic. Okay, and stuff. But also, just saying this to you guys and stuff, that we need our red blood cells, because they send that oxygen rich blood to all your organs so that they can function properly. If you're low on a totem pole, it ain't gonna send all the oxygen rich blood cells to everywhere and everything, because you're anemic. That means you got a lower count. So it can't freely just give them out to everybody and your whole body just functions right. So they kind of get stingy on them and send some out to everything so it can still work. But at the same time, you got to be able to find out how to replace that. And, there's different reasons why you can't replace it, religious reasons why you can't have a transfusion or something like that. But other than that, the people that it ain't no religious thing, you need to go get it done if you can, and everything, because it will help you and everything. So that was anemia. Also diabetes. So that's an unstable glucose. That means it's high, it's low, it's high, it's low. It don't know what it want to be. That's what diabetes. Welcome to diabetes. That's what it do in your body. So it's acting up, and everything and stuff. So these are risks for why you would be fatigued, because your body can't even regulate the glucose, right? So you sleepy and in the coma because it's too low. You sleepy and in the coma because it's too high. When do it get to the happy medium of normal and right in the middle, and stuff? It don't. It like to play around and play games. So you got to play with it and everything. Yes, Antoinette said iron pill. That's one of the good things and stuff. They give them to pregnant women a lot, and stuff. Iron, supplements and everything and stuff. Or sometimes you even they get fancy and they give it to you through the IV, and you go into a infusion clinic and get that done and stuff. But yeah, and that's for anemia or getting a blood transfusion, and everything. So either or and stuff, whatever the doctor feels is deems necessary and everything. And then there's also thyroid disorders. So we need our thyroid because it produces the hormones we need for our body to properly function and fire and do what it needs to do. And so when you're low or you're over, you got too many hormones, it causes a problem like glucose. You either don't have enough insulin, which is insulin is a hormone. So it's either not enough or not a sufficient amount, or it's too much, and it causes it to go really low and dip off to where it could be a problem, even death and stuff. So these are reasons why fatigue is so important to pay attention to if you're unusually tired, like a crazy tired and stuff. Also, another thing that will make you crazy or unusually tired is depression. I don't want to do nothing but just sleep. I don't want to do nothing. My life is horrible. What can I do? And everything and stuff. All of that. Welcome on in, Miss Josie, Auntie Josie, and stuff. She said, "Good evening, everybody out there." Yes, and stuff. I'm talking about your body is a snitch. Believe it. Part 2, meaning I had a part 1 before. I might go back and visit it again and everything. But I'm talking about fatigue and some of the risks, the reasons why you have the fatigue and stuff. So I said thyroids and stuff, and then depression and anxiety, and then also chronic infection, just infection after infection. So your body is always fighting. Then white blood cells got to always go and find something wrong inside your body. So it's tired. And then it just kind of gets worse from there. So the reason why that happens for fatigue, it's the body lowers the energy levels to conserve resources or flag a internal imbalance, or to say, hey, it's right there, and stuff like that. So then the doctor does the blood test and that's there they find it. So another symptom is shortness of breath. Why do we get shortness of breath? Like, what happened? And stuff. Possible causes: asthma or COPD. Everybody knows what asthma is, I think, but just in case, it's a problem where your if it gets inflamed, your lungs get inflamed in a certain way and stuff. It causes the body to hunger for more oxygen, but you're inflamed and swollen in the areas where you need to pull the oxygen in. So then you have to go into my niece actually has used to have really bad asthma, horrible asthma, when we was at the hospital all the time, 24 to 72 hours, and stuff at the hospital, getting treatment after treatment after treatment after treatment to help her breathing and stuff. I'm so glad that she's growing out of it, but still not out of the woods, but at least growing out of it and everything and stuff. And that's asthma. COPD is chronic obstructive pulmonary disease. So pulmonary meaning the lungs, referring to lungs. So it's a obstructive pulmonary where it closes off your windpipe also, but in a different way. It's caused by a different set of symptoms. Some you're born with, like an asthma, you could be born with or something like that, and then kind of grow out of it, or it gets better over time and stuff. COPD, it just tends to try to get worse and worse and worse until it stops you from breathing altogether. So it's definitely something to watch. But this is possible causes of shortness of breath, because your body is starving for the oxygen. It needs to get it, so it panics, and stuff. That's what shortness of breath is. And so some of the causes of it will be asthma and COPD. Heart failure is another one. That means your body is not beating at the right drum, and stuff. Instead of, I got it, I got it, I got it, boom, 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 boom. It's saying, I think I got it. I think I got it. Boom, 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 boom. Boom, boom. That's heart failure. I got it. Boom, 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 boom. I don't want, I think I got it. Boom, boom. Boom, boom. Yeah. You don't want your heart with an attitude. You don't want your heartbeat with an attitude and stuff. So that's heart failure. That means it's failing to be a good heart, a nice beating heart. And it's real harsh on us, and stuff. It's actually paired with congestive heart failure, which is a whole nother set of things. And your heart, you could just tell it's failing on you, and stuff. And it's hard. It's really hard and stuff. And that's a tough thing to go through. Also, blood clots. Don't sleep on them, because blood clots always usually lead to a stroke if not caught, and then given the proper medicines to kind of break it up, and stuff. Then it can lead to a stroke and stuff. And that's a whole nother animal. I taught on that already, but still, that's a whole nother animal. Also, anemia, because the low red blood cells transport oxygen, rich blood, and within its cell, and then it feeds everything. It feeds our muscles, it feeds the heart, it feeds the brain, it feeds everything and stuff. And what happens when you don't have enough? You got to conserve it, so it's feeding. I guess I'll give that one a little bit. I guess I'll give that. Yeah, you don't want that. Okay. And then panic attacks, shortness of breath. I don't know what's going on. You all over the place. Oh, you feel like you run 100 miles per hour, but you sitting there and you breathing crazy and and stuff. That's a panic attack, and stuff. It's a little more to it than that, but I'm trying to give you the basics so that you just get the gist of panic attack. Meaning it's a temporary thing, but it feel like it's impending doom, and stuff. It's bad. And everything. And those are some of the causes of shortness of breath. I can't catch my air, and stuff. You panic because the air ain't coming in like it's supposed to and stuff. And it's crazy, and stuff like that. So it's bad. And the reason why your brain senses low oxygen or increased pressure in the lungs and the heart, and it triggers rapid breathing, if that makes sense. Another one, a symptom, a snitch, a symptom, a snitch, a snitch, a symptom. It's chest pain. Possible causes. A heart attack. If you got chest pain, you grab your chest and stuff, you might want to call 911. Get somebody around you to call 911. You by yourself, call 911. Hey, I'm down. Unlock your door and go sit somewhere. And hopefully everything will be all right. And so that's one, is the heart attack. And then it's another one, you guys, and don't sleep on this one. And that is heartburn and GERD. So heartburn says it itself, but GERD, gastroesophageal reflux disease, or basically your esophagus is your food tube. You eat food, and then you swallow it. Instead of it going in your lungs, because it's not supposed to go in your lungs, or and something like that. It's supposed to go in your food tube. So that little flapper opens up, it drops down in there and it works its way in because it's a little muscle, but it's running along the same lines as your lungs, your lung tube or windpipe tube and stuff. So it's working its way down, and then it dumps. Flapper opens and the food dumps down into your stomach, so it can be processed further. So this esophageal, because I said gastroesophageal, meaning that GERD is a part of the reflux disease, which means that flapper that drops the food in there, sometimes it don't close all the way shut, so it lets some backdraft come up through the food tube. It's supposed to dump the food in there and close up, and it ain't supposed to let nothing in there. But guess what it did? It let something in there, and that little acid came up back through there, and the acid in your stomach is breaking down the food. So it got to be strong acid. And so if it's strong, guess what it's going to do? It's going to burn going in a place where it's not supposed to go, causing trouble. It ain't even supposed to be visiting your esophagus. Your esophagus is supposed to be dropping food down in there and taming the lion, but the lion didn't decide he want to come up through the food tube, from your stomach in the form of acid and burn the heck out of you. And then it feels like chest pain because it's burning. It's acid. It's burning. It ain't supposed to be there, so you get it. So that's where chest pain, that's another reason why somebody might yell chest pain. And it's really just their acid coming up in there, which is not a good thing, because after a while it'll erode the area, and then next thing you know, you don't have a place for your food to properly drop from your mouth down into your stomach because it messed up the tube, and everything, burning it up. Also, muscle strain and anxiety, like I told you about the panic attacks and stuff, and also lung infections, bronchitis. What is that? Bronch is the lungs. Itis is inflammation. So inflammation of the lungs. See? That's the medical terminology for you and everything. So then the why of chest pain. Chest nerves overlap, so the body sends strong signals when something in the heart or lungs is stressed. So in that area, you got a lung on this side and a lung on this side. Normally, you got a lung on this side and this side, or maybe you might have one. But either way, it's right there in that area. So if some acid comes shooting back up or something like that, or a heart attack or something like that, it's going to send out, hey, to everybody, and stuff like that. And that's where that comes from. Antoinette said, wow, I didn't know that. Yes, cousin, and stuff. That's what I'm getting to. I'm just trying to break down why our body acts a fool. It's not really acting a fool. It's just trying to tell us, what's happening. Now it's up to us to actually listen to it, but it's gonna do what it gotta do and everything. Yes, about bronchitis. So broncho or bronch, that's referring to your lungs. Pulmonary or pulmo and stuff is lungs. And then itis is always inflammation. So if you got a colon is colon. Okay, so colitis is the colon and inflammation of it, and stuff. So that's how they put those words together. Yeah, it's not too bad, and stuff, but that's what happens and everything. But once you start figuring out, oh, that means that, and this means this. So, okay, that's why it's the inflammation in this area, or, that, or, the such and such or so and stuff. That's where that comes from and everything. Yes, thank you. And then another one, everybody sleeps on them. How many of y'all use Tylenol? Headaches. That's a symptom. Headaches and stuff. Now I'm gonna go a little bit faster and stuff, but headaches. The possible causes of a headache: dehydration, or what I call starvation, not eating. And not because you're fasting for religious purposes or something, but just not eating. and everything. And then next thing you know, you dizzy and you got a headache and you mad and you ready to beat somebody, and stuff like that. So the causes of headaches is usually dehydration, or I call it starvation, or whatever you want to call it, missing meals and stuff. Another one is high blood pressure, okay, for headaches. And then another one is any type of migraine disorders. If you got a migraine, it really is a migraine. But sometimes after a while, the migraine start. You can't tell the difference between a headache and a migraine. Just one of them stick around. The migraine sticks around a bit longer than the other one, and that's I guess maybe the slight difference between them both. And then also infections can cause headaches and stuff. And the infection is a fever due to something else being wrong, like especially when we have our colds and flus, and this that season for that and stuff. And what do you get? Even with COVID, what was the number one culprit? A headache, and stuff, a bad migraine and stuff like that, feeling like somebody pounded your head in or something like that and stuff. That's where all of that comes from and everything. And so infections. And then also, this is the one that everybody sleeps on. Visual strain from looking at that phone and rolling that bad boy. You doing all that with that phone and stuff, and can't see nothing because you straining them eyes. Okay, if y'all don't want to tell it, I'll tell it. I did it. I got all types of headaches and migraines and stuff. Trying to look at that thing, got my neck all jacked up and stuff, and had to go and get a shot of Motrin and stuff like that because I got stiff neck and stuff. I told him it was something I was working too hard. I was working that phone too hard. Woohoo! Let me see what else is on here and stuff. Whatever. And so I'm just saying. And I'm trying to keep it lighthearted, and stuff. I don't want to lose you guys because I'm giving you so much information and everything. But all those things are the reason why it causes headaches. But the reason why you get the headaches is because blood vessels, nerves, and muscles around the head become irritated or inflamed. Stiff neck. Okay. So another one, this one is really important. I remember I said I wanted to do this one, and that is a symptom. It's called swelling, edema. Who has ever heard of that? Edema. Y'all know what that is. That's when them ankles turn into cankles. When them ankles and knees and everything get all swollen. You didn't have some little what is that, little footy socks on, little booty socks and stuff like that. And then when you take them off, your foot is this big, and the sock, your ankle is this little, and then the rest of your leg is this big because you didn't have them socks on, like you didn't put a rubber band around your leg or something. But it's because you swelled up. So it's not funny what it's doing, but it is a shame that we didn't seen it. Of course, it's not deadly, but you probably want to pay attention. Antoinette said, yes, I have. And yes, I have. I remember you telling me, I don't know if you remember this, Antoinette, but I remember you telling me, take them, all them chains from around my ankles. He was like, cuz, your ankles is hecka big. Like, what is you doing and stuff? And I was like, this is cute. This is cute. I don't care. This is fashion. Yeah, that thing, my ankle was so little. my calf, all the way up my calf was big. My foot was big and everything and stuff. And I took them down. It only took about a day to get them back. But boy, oh boy, if I would have kept that on there and stuff like that, you remember, but wasn't I styling though? And stuff. Remember that too? She gonna say, yep, but remember what not stylish? Because they was cute on there. I look like an African princess. Okay. Well, Jamaican princess. Okay. Whatever, a princess. Yes, but now I'm talking about edema. And so the things behind that is the biggest thing was the swelling or edema can indicate heart failure. What if I was in heart failure? Oh my God, and stuff. And I got the nerves to be having all this stuff all on my ankles and stuff because it was cute. Well, I messed around and found out, and I've been good ever since. But it did take my cousin who loved me so much to go ahead and get on my case, cause you got to take them things off of you. You got to get them off of you. I don't like that. I think I was gonna stress her out and cause a panic attack if I didn't take them off. So I took them off and everything, and I haven't put them back on a day since and everything. So thank you very much, because that was showing me something else could have been wrong with me. And I wouldn't even known it because I was just trying to go with the fashion and everything. But then you got other things like kidney problems could be wrong. So what if that was going on? I would have been masking it because I didn't even know that I was even doing something wrong, and everything. It was a fashion statement, even for the nurse and stuff. Then also liver diseases. Your liver is your filter. It filters your blood also. And so if the liver was acting up or something like that, I wouldn't have been able to know, because I still got my little chains and stuff all on my ankles and stuff like that, just being cute and sick, or something could have been, and stuff. So thank you so much, Antoinette. And then also indication of high salt intake and stuff. Salt is good for you. Nobody says salt, just like sugar, is good for you, but in excess, it's a problem and stuff. So I'm saying that. And then medication side effects. Sometimes they'll cause fluid retention, and that's the reason for the swelling. And so sometimes it's just our medication that we're on, and everything. So that's one reason and stuff. And so the question is why? That was a symptom. The question is why. Fluid builds up when the body can't circulate or filter it properly and everything. So the fluid builds up when your body is not, when your body is imbalanced, it's not working properly. So that's why it could be kidney problems. It could be heart failure. So it could be heart problems, kidney problems, liver problems, a high salt intake, or medication side effects causing you to have all this swelling in your body and everything. Even hands, getting those swollen hands and stuff like that, and different things and stuff. It's so much, but that's where all of this comes in at. And then one more, and that's mood changes. So mood changes and irritability. What are the causes? One is hormonal, and that could be low testosterone or low estrogen, for women, and everything and stuff. So those being too low and stuff can cause mood changes and irritability and ready to fight, and stuff, and just quick to be mad, and stuff like that. Also, chronic stress. They want me to do this and this, and I got to do this, and it ain't even enough time in the day to get all of it. Yeah, chronic stress. I got to pay this bill, and I just paid this one and stuff, and now they asking for some more money and this and that and this and that. And yeah. You're not going crazy. You're lifing. You're getting your life on and stuff. Vitamin deficiencies. That's why you need your B complex and your B12s and your B this and B that and all of that stuff like that and everything, because they make a difference. Each B has a different spot on your body. One take care of your eyes. One take care of your heart. One take care of your muscles. One take care of your brain, and stuff like that. And so on and so forth. Not just B vitamins. I'm talking about all the vitamins. They all play a role. Magnesium plays a role. Potassium plays a role. Calcium, phosphorus, all these things, they all play a role and stuff. And when they're imbalanced or low or one is okay, but the other one's is too low, it's going to cause the trouble. They need to be in unison. They need to be working together as a whole team. And when they don't, it's a problem. Antoinette said, yes, I take vitamin B complex every day. Absolutely. That's good for you, because that's probably the only thing keeping you running, and stuff, and being able to run like you do every day and stuff. You wonder where did I get that extra strength from, and stuff like that. It's because a good vitamin that your body is metabolizing, meaning breaking down and using it and stuff, is good for you. So it's going to cause a lot of stuff. It's going to cause your mind to be sharp. It's going to cause your body to be sharp and have that energy you need to push forward through your whole day, and stuff, your full 8-hour shift or 10-hour shift or whatever you do and stuff like that. And then be able to go and do your after hours, after I'm off work type things and stuff, grocery shopping, all of that stuff, and get it done and put the clothes together and wash the clothes and get them done and cook the food and, and all this stuff that you might have to do, or he might have to do, or whatever it might be and stuff. All of that stuff plays a role in everything. So for mood and irritability, I told you, hormonal changes, chronic stress, these are causes for you to have mood changes and depressed or happy, and all of that stuff, or irritable and mean and mad and stuff. Sleep deprivation. I don't get no sleep. Everybody gonna know that Charlene didn't get no sleep. Nurse Charlene didn't get no sleep, because Charlene could be, yes, how y'all doing? You didn't get no sleep? Okay. All right. Yeah, that's what no sleep means. Okay. Y'all seen that? But anyway, thyroid disease. Okay. See that? You can turn it on and turn it off. What a mighty thing we do and stuff. But anyway, why? Because the brain's chemistry shifts when hormones, sleep, or nutrients are disrupted. I'm low on B12. I'm not going to be all perky and stuff. Why should I? I don't want to be perky. But if I got my vitamins on and I'm good, y'all going to get the best of me. That's right. So I was going to break it down into age groups and stuff like that, because they said different age groups snitch differently because the body changes over time. So I'm gonna kind of run through them real quick. And that is children and teens. That means preteen and teenagers and stuff. Warning signs that something is wrong. The body is snitching. Sudden fatigue. They unusually tired. They ain't got no job. What they tired for, and stuff like that. But pay attention or pray attention. A fever lasted more than 3 days. Do all the kids at school got this too? And stuff. Oh, they sent the whole class on? Oh, okay. And stuff. Pay attention. Unexplained pain. Why is you sore? Why your lower back sore? Why? Who did something? Did somebody kick in your back at school? And stuff. Okay, I said children and teens. So pay attention. And then also extreme thirst and urination. Do you know that that's a couple of the P's from diabetes? Do you know the kids, if you catch it early enough and stuff, they might have type 1 diabetes and it kind of slipped over it a little bit. We skated over it, but then it got worse. So now they're juvenile diabetes. And everything and stuff. So extreme thirst. So for diabetes, the 3 P's is polyphagia, which is excessive eating. Polydipsia, which is excessive thirst. Want to drink water. It's okay. Water and stuff. And then polyuria, excessive peeing. I gotta pee. Everywhere I go, I gotta pee. So if a kid is presenting with even 2 of them, you might want to get them checked out. Don't brush it off. It's not a brush off type thing. But I'm saying that's what put them at risk. Their body snitches, even at a child's age and a teenage age. So you see how important that is and stuff. So then at higher risk, they could be dehydrated. They can have possible asthma or some type of viral infection. That's why they got the one less, the meningitis and the HPV, whatever, the vaccines and stuff. I talked about vaccines before and stuff like that. That's where that all comes in at. So then the next age group, 18 to 35 years old, 18 to 35ers, just in case you're on there and stuff, 18 to 35. And that would be warning signs, chest tightness, palpitations. That means your heart is irregular. It's beating boom, boom. It ain't just boom, 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 boom. It's boom, 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 and all of that stuff. Palpitation, headaches, and mood swings. That makes them at risk for anxiety disorders. So this could be what's going on for someone 18 to 35 to look out for. Look out for them, you know, and everything. So 18 to 35, and it's anxiety disorders. Hypertension starting early. So watch out. Don't sleep on that. They can get hypertension too, just like the children can. Autoimmune diseases. That's your lupuses and different things and stuff. It's a lot of stuff that attacks us, you know, early, but a little bit later than teens in life, you know, and everything. And overuse injuries. Always sports injuries after injury after injury. The knee, the back, the ankle, the both ankles was broke, the wrist broke, the so-and-so broke, and everything. That's a lot to take on. And your white blood cells don't know what to do. They don't know when to attack, or is it something that can be set and put back together, you know, and stuff. So that's a problem. And then middle age, they call it. I don't think that's middle age, but anyway, 36 to 60. And some of the common warning signs: shortness of breath with activity. That means you out of breath with just simply walking, simply running on a treadmill or something, just running on the treadmill for a short amount of time, like nothing to really write home about and stuff, but that's happening to you. Abdominal pain, high blood pressure, or new onset of fatigue, unusual tiredness. And that puts you at higher risk for heart disease. That's coronary artery disease, the stuff that causes you to have a heart attack or a stroke. Diabetes, a stroke and stuff. And then thyroid issues. If the thyroid can't secrete the hormones that you need to keep your body in running order and stuff, that's a problem for you. And then cancers, opening up the door for cancers, and that's all the way up from 36, I think it's 36 to 60, and that is colon cancer, breast cancer, or prostate cancer. I said 60, you know, just to make sure y'all know that and stuff. And then your seniors, last but not least, your seniors. And that is common warning signs: confusion or memory changes, like not knowing who you are, not remembering, or going back to back in the day or something like that. And you like, yeah, I'm older now, so what happened, you know, and stuff like that. That's where that comes in at. And then frequent falls. That's why they always ask you at the doctor, have you had a fall in the last 30 to 60 days or something like that, and everything, or in the past 2 weeks even, and everything, because they want to know what's going on, what they need to be looking for. They're not asking to be nosy. They're asking to try to make sure that they take care of you. And then rapid weight loss. And that can happen for so many reasons, including Operation Cancer. Okay. And then swelling in the legs, that edema that we talked about. And this is for seniors. And it puts them at higher risk for a stroke, dementia, heart failure. That means the heart is not doing its job properly because it can't. Kidney disease, them kidneys acting up. And medication side effects. It could be the side effects of your medication. It's time to change to a different one. If we got to fight this many things just to keep you on this one, then it's time to go to another medicine and everything. So I was going to do myth versus facts, but in order to look at the time, I might be able to do a couple, and then I'll get you guys out of here in 10 minutes. And that would be myth. If the pain comes and goes, it's nothing. That's a myth. The fact is, intermittent symptoms are common in heart disease, stroke, and cancer. That means intermittent means it comes and goes. It's not constant, but it'll come and pop up on you, and then it'll leave you alone for a little while, and then it pop up on you, and then next thing you know, you like, doctor, I can't take this diagnosis. Yes. Welcome on in, Bria. Good to see ya online and stuff. Welcome on in, dear. Yes. And then a myth. Fatigue just means you need more sleep. Remember, I told you fatigue is unusual tiredness and everything. Fatigue is one of the top symptoms of heart, thyroid, liver, and blood disorders. It got a whole bunch of big heavy hitters and stuff that it's a problem for, and stuff. So when you have fatigue, you better watch out and you better pay attention and stuff and tell on it. It's telling on you, tell on it. Because it might be something that you can't come back from. You can't pray it away or nothing else and stuff. You just kind of lost and everything and stuff. So pay attention. It's normal to be out of breath as you age. That's a myth. It's normal to be out of breath at your age. Bria said, how are you and Brittany and mom? Oh, we're doing great. How are you and your mom and sister? Yes. And stuff. Yeah, you're going to have to message me your phone number under Messenger and stuff so I can talk to you. Yes. But so I said it's normal to be out of breath at your age. And then the fact is, shortness of breath is never just aging. It's always worth checking, because if you're out of breath, it's messing with, okay, that's good. Glad you guys are doing good and stuff. At your age or any age, it's not ever good to be out of breath. Not because you just ran and you catching your breath, but totally out of breath and stuff, that's a problem. Definitely. And then myth number 4. If a symptom isn't severe, it's harmless. In fact, early symptoms are usually mild. Severity comes later. That means they went back when you didn't listen to it. It went back and found a friend, and stuff. Now it's coming with a migraine and some dizziness. And guess what? We just gonna blur your vision so you can't even see either and stuff. We'll fix you then. You gonna pay attention? Oh, you're not gonna pay attention? Okay, I'm gonna put you down on your back. Now you listening, huh? Okay. You see what I'm saying? So that's what it does to everybody. I'm not the doctors are included. Other nurses are included. Yeah, we all human beings. So nobody gets to get out of it and stuff. If they don't pay attention because they think they're the best of the best or whatever and stuff, or I think I'm the best of the best, guess what? We can get it just like anybody else. It's the equal opportunity lender. And it'll do your doctor, it'll do your nurses, it'll do the techs, it'll do the pharmacy technician or the pharmacist. It's hitting anybody and everybody if you're human. Okay. And stuff. Welcome on in, Mr. Buckner. He said, I'm late again. That's all right. You can watch the replay. I taught you how to watch the replay and everything and stuff. So it's okay and stuff. But I was talking about the topic tonight is your body's a snitch, believe it. And I'm just now down to the last of it and stuff. I'll probably be on for about 5 more minutes. And that is talking about the different myths and facts. And so Last myth. Men have more heart attack symptoms than women. That's not true. In fact, women often have different symptoms like fatigue, nausea. So unusual tiredness, nausea, back pain, which leads to misdiagnosis because they think they just need to lay down, eat something, and they'll be better. And they having a whole heart attack and stuff like that. So no, it's not that men have more symptoms and stuff. It's you both get more symptoms. Pay attention to them. This is your body. You only get one. And there can never be, like I say, another you that act like you, do like you do and stuff. No matter who produces it. If the same mother and father produced this next baby, it's never going to act like the baby that was before that one, you know, and stuff. It just doesn't happen. And so it's only one soul, one you and everything. So my take home message. Your body whispers before it screams. Your body whispers before it screams. Thank you, Bria. You said you messaged me. Thank you so much. And then subtle symptoms or subtle snitching are early warning signs. Listening early prevents medical emergencies. Never ignore changes that are new, feel unusual. They just don't feel right. They don't sit right with you. Things that get worse, don't ignore them or affect your daily life. If you come with chest pain, confusion, severe headaches, or shortness of breath, that's a problem. Okay? If you come with any of these things, chest pain, confusion, severe headaches, or shortness of breath, you can't catch your breath, it's a problem. It's a medical emergency. Don't ignore these things. We will never get another you. There will never be another me. Not exactly me and everything. Age does matter. What is normal in a child is not normal in a senior. Know your risk category and family history. Give it all to them. That's how you get to the bottom of things and you get to the other side without feeling like you got to just cry about it and plan a funeral and stuff. Sometimes you could get that big bang, which is that big diagnosis, but then you could squabble up. That's what my mother say, squabble up, you know, and stuff. You get that big diagnosis. What you gonna do? Or is you a man or a mouse? Is you gonna step up to the plate, or is you gonna sit back and let it take you? It's up to you. But ignoring it is not gonna help you. And stuff, finding out and arming yourself with education. Yes, Bria said amen. That's right. Getting that education, getting somebody like me or others to talk to you, you know, and everything, and pump you up and let you know that you are that important. You are worth it. You are worth it and everything. So another thing is small symptoms can point to big problems. Fatigue, swelling, headaches, and mood changes are not just life. They have medical causes. It's a reason behind them. Prevention is cheaper than treatment. Yeah, say that to my mother's $800,000 surgery and everything and stuff. Annual checkups, your blood work. They always sticking me with needles. Let them stick you. I don't like needles either. I don't like them going in my veins, and I got big old giant veins, and I still don't like it. But I bet you I get it done, okay, and stuff. So, blood work, blood pressure screenings. They catch problems early. I was stressed out. I was telling everybody, "Yeah, I'm okay. Yeah, I had to give me a little bit of blood pressure medicine." Now I'm of course, eventually when I see that I can control everything and effectively cope, I'm gonna take myself off. But that's me. That's not everybody else and stuff, you know, and everybody to each his own and stuff like that. But as long as I know that I'm stressing, I'm gonna take care of it. But at least I tell. I at least, you know, let me pat myself on the back. I told on it. That's what I'm saying. and stuff. So what else did I want to say? If something feels off, trust your body. If it feels off, don't ignore that. That's your conscience telling you something is wrong. And it's always better to check and be wrong than ignore it and regret it. Check it out. And oh, it's nothing. You just did you go to blah 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 and so? Okay, that's it. Okay. Oh, okay. Thank God and stuff. Or, oh yeah, this is wrong. You have this. And then you got to figure it out and stuff from there. It's like, oh no, please help me, and stuff like that. That's where that comes in at. And then last but not least, and I'm going to leave y'all alone. Y'all can enjoy the rest of your evening. And that is that your body is the loudest truth teller you have. It snitches on infection, stress, organ problems, hormonal changes, heart disease, and more long before they become serious. Long before they become serious. Paying attention to symptoms, paying attention to your body snitching, understanding your specific age group and your risk at your age group, and acting early could save your health and your life. You got to find out early, even if it's something bad. Find out early. They got so many treatments, so many scientists, so many, boss people that's stepping up to the plate, getting these things done, and they got so much stuff for you. But if you don't find out early, what's gonna happen to you? That's the only thing I can say. I'm not telling it to you, and I'm not fussing at you. I'm just telling you, I lived it. I lived it, like literally lived it and stuff. And I'm telling you out of my own conscience and stuff that this is no joke. Sometimes I try to be funny and stuff on there and everything, but at the end of the day, you're going to see me drop back and regroup, breathe, and then tell you, hey, this is important. It's a matter of your life or your death. My life or my death. Okay? And stuff. Antoinette said, good information, cuz. Thank you. And Bria said, you going to fall? Oh yeah, you're going to fail. I'm not sure, Bria. Write down what you meant to say and stuff. But yes, the whole point of this is trust your body. Your body is telling on you. It can't tell a lie on you because it's in there looking. While you looking at the outside and what's going on outside and stuff, it's looking on your inside, and it can see everything. It can see when the heart is acting up or having a problem. It can see when the lungs are having a problem, when your circulatory system is having a problem, your veins are not acting right, your red blood cells are low, and you're anemic, and all this stuff. And it's trying to tell before it turns into something that you can't come back from. And most of the time, when we ignore it enough, yes, Miss Bria said, if you don't listen to your body, it will fail you. It will fall down on you. It will give up because it's like, she not listening to me. I even went and got some partners, and stuff to come and tear her up, and she's still not listening. She just took some Pepto-Bismol. Does she know that Pepto-Bismol doesn't heal it? Exactly, and stuff. So no qualms about Tylenol, Pepto-Bismol, Motrin, or nothing like that. I'm saying they don't heal you, and they don't say it in their commercials or anything that they heal you. They say that they treat a symptom. Treating a symptom and healing the reason why you had the symptom is two different animals and everything. Everybody can make a headache go away with enough things. Ice pack, Motrin, Tylenol, and all of those things, Aleve or whatever and stuff. But treating what it really is, that's the important part. Your body is trying to tell on you. You got to believe it. You got to believe it. It's in there looking. And it's gonna do it quietly first. Then it's gonna yell at you. And when you don't yell, it's gonna drop you. It's gonna drop you, including me. Yes. So you guys take care of yourself. You're important. Each and every one of you guys that are listening and get a chance to watch the replay and everything, remember your body is talking, including me. And guess what? I can't be right if I'm not taking care of myself and I'm trying to tell you guys what to do. So I have to do it too. And it's actually made me accountable for myself even more so that I could be around for my grandchildren, so I could be around for my family and everything. They don't want to lose me, and I don't want to lose none of them. Each and every one of them is important. And so the moral of the story is we got to take care and pay attention to our body. It's telling us something. Stop ignoring it. I got to stop ignoring it. So I'm talking to myself also. And you guys take care until I see you again on the following Tuesday, which I think is the 16th of December. And I'm going to go all the way up until I can't, and everything and stuff. And then we'll start back in the new year and stuff. But I'll give you a little warning, precursor to that and everything. But you guys take care of yourself and your loved ones. I need you to help me, help you, help yourself and your loved ones. Because your body is a snitch and you got to believe it. All right, you guys. Thank you so much. I'm airing off and stuff. Thank you for all your comments, all your everything that you put in and stuff. Thank you for taking your time out and everything. And remember, if you came in the middle or towards the end and stuff, it's okay. Never fear. It'll be back up live. Without live and stuff. It won't have me on there and stuff, but you can watch the replay on Facebook, Charlene Nurse Allen, and then under YouTube it's Medical Talk in Layman's Terms with Nurse Charlene, and you can watch even past episodes if you go to that and YouTube and put that in and stuff. And I got some more exciting things coming, and my guest speakers are lining up. They're ready to go. They're just telling me when to release them, and everything. So I'm going to get all of that in and stuff. And I thank you guys. And I thank all of you guys that keep tuning in, and even the new ones you coming in and stuff. Now you're going to get hooked. You got to come back again. I'm on every Tuesday unless I say so. And you'll see that on Facebook. But I'm on every Tuesday starting at 7 p.m. And I go about an hour and 20 to an hour and 30 minutes tops and everything. But I thank you. And y'all take care of yourself and your loved ones. We got this. We got this. We're going to do some new things. All right. And thank you, Auntie Josie. She said good information. All right. My job is done.